On the subject of leadership, I'd now like to introduce Dr. Philip Crowley. Philip has a long career in public health medicine. He works as a practicing GP part-time, and he is the National Director of Health and Wellbeing Strategy and Research. So, Dr. Crowley, thank you very much for coming and welcome to the stage.
Thank you very much, Martina, and it's really lovely to be here. The last time I was here, Leinster beat Toulouse, but unfortunately the weekend didn't go so well. It's great to see so many people together. It really is nice meeting people. I'm sure we've all missed it a lot. It's been a pretty bleak couple of years in so many ways, and it's just lovely to be back together. So thank you for inviting me, and it's very nice to be here. Really impressed to hear that Taoiseach and Paul's kind of obvious commitment to what we're doing. We need to really kind of tap into that, because the 2025 goal of a tobacco-free Ireland obviously appears very, very challenging now. It doesn't mean that we give up on it. It may slide, but it's still our goal, and we still work towards it. Some of the data that we presented today is a little bit disheartening. Some of it during the pandemic, maybe overall rates not quite as good as we would have liked. Younger people may be doing a bit better, but I wouldn't feel so down about that data, I have to say. I think overall the trends are good. I think the fact that so many people in Ireland who do smoke are interested or thinking about quitting, that's kind of the key stat for me, because that means that our work has got a receptive audience. We just got to make sure our work is good and well targeted, and I believe that it really is. I think, you know, my practice is with the homeless. I work in the Granby Centre as a GP, and obviously addiction is a big problem there. And smoking is a very major problem there as well. And obviously there's a big focus on heroin and cocaine use and alcohol, but smoking is a really big issue there as well. And I certainly we will be making sure that we do not leave my patients behind either as we go for a tobacco-free Ireland. Because the socioeconomic context, as the Taoiseach laid out, is increasingly important. And if we don't target our services as we are now doing, I believe we would end up leaving people behind. Because if you apply general health promotion messages to the general population, the more well-to-do are more well-equipped to take up those messages, and the least well-off are least well-equipped to take them up and will be left behind. So that's why we're targeting our services, and I think that's really good. I think that, as the Taoiseach has alluded to, there's action we need on legislation, on taxation, public campaigns, and very particularly support. And I think our environmental health service is playing a kind of a pivotal role really in kind of building and ensuring compliance with the legislation that we have. So tobacco endgame is the goal. Interestingly, a survey I think will be referred to later on, where we surveyed 1,000 people, and I won't, spoiler alert, say what's in it, but it's very promising to see the kind of support the public have for what I think everyone in this room believes is the right thing to do. So I think overall, we need, as a health service, to really pivot to prevention. We spend billions on end-of-life care, on chronic disease, 60% of which is preventable. It's absolutely crazy. And we've started now to get serious investment into prevention, but it needs to be way more serious. We need to get more investment, we need to get more people on the ground, we need to get more targeted work in inner city communities, and we need to learn from places like New Zealand, which we'll hear about from today, and from our other excellent speakers that we have today. So look, overall, I'd just really like to thank you for being here, for the support that you being here represents to each other and to us all. I'd like to thank Martina and Paul, obviously, and Ed, Elaine, Elva, and Katrina, and a special mention for Fenton Howell, who's an old warrior colleague of mine from many years ago. He's still very young, though. So look, it's lovely to be here, and thank you for having me to speak, and best of luck with the day. Thank you very much.
Thank you, Dr. Crowley. It's wonderful to have you here today to strive to deliver on this agenda. And we know that working with marginalised communities is close to your heart, and that's where we need to be in terms of tobacco control and services as well.